Hello, I'm Dr. Jyothi Raghuram, Senior Consultant Pediatrician at Aster Women and Children's Hospital in Whitefield. And let us address the very common topic, diarrhea in children. And in this season particularly, we are seeing a lot of children coming with symptoms of the viral stomach flu, or what is known as diarrhea in medical terms. So what is diarrhea? Any change in the bowel pattern and consistency is called as diarrhea. Both frequency and consistency needs to be showing a change for us to call it as a pathological diarrhea. Now, a normal breastfed baby may pass stools even 10 to 15 times a day, and it may be watery stools. However, this baby is happy, is feeding well, is gaining weight well. So this is not an illness, and this should not be treated. This is normal breastfeeding diarrhea, and which is normal for the child's bowel. As the baby grows, the bowel movements do decrease in frequency. But if a child who is passing stools normally only once or twice a day suddenly starts having many episodes and the stools are watery in consistency, then this is diarrhea. What is dysentery? Dysentery is when the stools are associated with mucus. Sometimes blood also may be seen in the stools. And this is typically seen in bacterial infections in infants and children. And there may be parents may say that the child is having crampy pain just before passing the stool, and there may be high fever also. So this is generally due to bacterial infection. So parents do ask us, what are the causes of diarrhea? We ensure that my child has a healthy diet, and we do ensure proper hygiene at home. So sometimes there is really poor hygiene is not the sole cause for diarrhea. So it's something like a democratic diarrhea, where it may affect all classes irrespective of the socioeconomic status of the family. Typical of this would be enterovirus infections, which we see in small children and which spreads from child to child, especially in play schools or in schools. And this may be spread through the fecal-oral route, hand-to-hand transmission, or a child eating from the other child's food box, or drinking water contaminated. Or it may be even a viral infection which spreads through respiratory spread also, which can cause diarrhea. Sometimes there are parenteral causes of diarrhea. That means the cause is not in the intestine but elsewhere. A ear infection, otitis media, or a tonsillitis, or even a urinary tract infection can come with fever and diarrhea. So it's important to think of causes other than the GI system. Parents do ask us, doctor, how do we know what food to give? What is absorbed and what is not going to be absorbed? What diet changes should I make during diarrhea? So the diarrhea can be due to a maldigestion, sometimes in the stomach, in the intestines. It may be due to a pancreatic problem. It may be due to the malabsorption, which is normally happens in our intestine. Small intestine is the major organ where absorption happens, and then in the large intestine where water gets absorbed. So we normally advise parents to continue giving all the foods to the child, even though the child may pass loose stools after eating food or drinking something. While ORS continues to be the mainstay of treatment, it is important to ensure a normal diet. There is no need really to stop milk or dairy with just a few episodes of diarrhea. That has to be done only in certain circumstances. Sometimes patients ask us, doctor, my child is passing green stools. I'm very worried. So this is again normal. It only indicates intestinal hurry, and you don't have to worry about green stools if your child is otherwise well or not showing any other illness. Sometimes diarrhea can become chronic. So if it's repeated episodes of diarrhea, it's recurrent diarrhea. If child is well in between episodes, do not worry. But if the diarrhea continues for more than 14 days, then that is definitely chronic diarrhea, which needs a specialist consultation. If your child is showing signs of dehydration due to diarrhea, which you will know from the child's appearance, sunken eyes, lethargic, dry mouth, and not passing enough urine, not taking enough orally, please do bring in the child for consultation, or even to the emergency if it's in the later after OPD hours. We are here, a team of pediatricians, to help assist your child getting better, both in the OPD and in the emergency room. And if this diarrhea is associated with dehydration or other causes, then definitely child will need a closer look and may even need hospitalization and intravenous hydration.